just for fun for newbies, yeah, when you go down the spine, if there's a specific like L5 S1 disc, if you perhaps shoot it or click it or you go out the spine, that I guess I suppose at a very simple level, is there a connection of this specific area of the spine connects how your pinky works and your elbow? And like say, just give us a fun little like
100%. Let's think of a good example. Often a good example is patients who have Achilles issues. Okay, long histories of Achilles injuries, Achilles issues. Now, by and large, generally they've gone to physio, they've gone to bio, and that muscle, those muscles have been stripped out, the tendons been treated, so the cars come home, and you've got
your keys as we don't that's not attended just to confirm, yeah.
often, that they would have had the books thrown at them. They'd had shockwave therapy, they've been needled, they've been stretched, they've been, you name it. And they kind of manage this Achilles pain, which is incessantly there. Now, there's a very, very strong neurological connection between the bottom end of your Achilles, your soleus and gastroc muscle coming down onto that Achilles tendon that is innervated by your L5 nerve. Okay. L5 nerve being the last lumbar nerve coming off the base of your lumbar spine. And in most people who have any kind of office job, sit in front of a computer, drive, spend most of the day sitting, there is compression down onto the L5 disc.
So just for simple terms, if you can think of our spine, the L5 is the lowest nail of the spine. It's the last disc, which is connected to your.
So we're sitting, there's compression of that disc, which then decreases the hole on the side where the nerve comes out. And it doesn't necessarily mean that that nerve is being damaged or compromised in any other way than the whole way it comes out has got snored. Now, there's a lot of structures that sit in that hole. There's a bit of body fat, there's arteries, there's veins, there's lymphatic drainage, there's other little nerves. There's a lot of stuff that goes through that hole. And where it used to be nice and big and wide, now it's probably half the size. That area gets a bit claustrophobic, a little bit cramped in. And the best way to describe it is that nerve gets a bit claustrophobic and starts to go, on this here. I'm not comfortable within the space.
So now what do you do when someone comes to see you?
So to try and get the function and mechanics back into that area, it's great. So we try and create a little bit of space on that disc, either using a sort of flexion, distraction type of techniques to try and open that disc a little bit. Whether demonstrably there's a change in the side of that disc or not is probably irrelevant, but we create a little bit more space. And in doing that, it opens up the whole enigma.
So then a sort of one fix wonder. It's a process.
And returning the function to that area. So you can't just look at the disc on its own. You've got to look at the two joints at the back. And they all relate, but they talk about a two-joint complex.